Alright guys, so right now we are looking at a right shoulder as if this person was facing you. So I've got the clavicle here in my hand. We spin it. Now you would be looking at their back. And again, the right shoulder. So now that we got a little bit of orientation, let's get started. So as I already mentioned, even though this model is a little bit broken here, this is the clavicle. This end of the clavicle marks one side of the sternoclavicular joint. Obviously one part being the clavicle, the other part would be the sternum, which you cannot see here. As we make our way down the clavicle, this middle 1/3 area where you can kind of see that bend, that's somewhere that's extremely prone to fracture. It's actually the most common area of fracture on a clavicle. As we make our way down the rest of the clavicle, you'll see that it eventually meets this little notch. And if you look at it from a superior point of view, this is the acromion process. So where the clavicle meets the acromion is called the acromioclavicular joint. And what is in layman's terms known as a shoulder separation is actually the AC joint separating. So these people with a severe AC separation, you'll notice a little bit of a bump under their skin. That's actually their clavicle because this soft tissue has ruptured. Alright, so moving on from the acromion process, I'm going to turn this person around. So now we're looking from the back side towards the front, and we still have the right arm here of the person just to give you a little bit of the orientation. So from the acromion process, we'll see that it's connected to the entire scapula by the spine of the scapula. And this is a pretty irregular bone, but it's not too bad anatomy-wise. So here we have the lateral border. Here's the inferior angle, the medial border, the superior angle, and then you'll notice that where the lateral angle would be, that's actually what is part of the glenohumeral joint there. So this fossa on the back is where your infraspinatus will sit. Your teres minor is going to come right here, and we're going to cover that again in the next video. Let's move to the lateral portion of this. You'll see that, again, where this joint is, this is known as your glenohumeral joint. There's a lot of muscles and tendons here that make up all of those rotator cuffs. This is your right humerus, and just a few quick landmarks on it. This big bump right here where you're seeing a lot of these muscles and tendons connect is known as the greater tuberosity. If I make my way a little bit more anterior, you're going to see this groove. It's known as the bicipital groove, and I'm guessing you can guess which tendon goes through there. And finally, if I go even more anterior, there's one more bump known as the lesser tuberosity. To cover a few more things on the front here, again, the clavicle would normally be up like this. This bony protrusion coming out of the scapula is known as your coracoid process. And this fossa back in here, which you could feel if you reach into your armpit, is known as your subscapularis fossa. And that's, as you probably guessed, where your subscapularis sits, which is one of your rotator cuff muscles. And in the next video, we're going to start with this groove right here where the supraspinatus sits.